space bar. Let's see, let's set this knees upon it. Relax. How you doing, guys? So we have a guest over here. Okay. So in this video, we're going to talk about deviated septum. You know what it is and how we're going to take care of it. In addition to, we have some other bonuses. So first things first, let's show to the viewers over here in terms of deviated septum. Clearly, I can hear you, maybe the viewers as well. How's your breathing through those nose?
Very congested. Very congested. It congests a lot.
Okay. Yeah. Fair. Can you? Yeah. Block off one nostril. Breathe. Okay. Try the other one. Okay, so clearly it's all congested in there. Yeah. And then going down the other laundry list of stuff. So the next matter you want to take care of is, which you want to take care of? The shoulders or the elbow? Which one?
Let's do the shoulders.
Okay, so what's going on with the shoulders then?
So the shoulders lock every time, you know, I bring it back. Like, let's say if I'm going to stretch or anything, you know, I could be sleeping. And if I turn and I feel, you know, that I'm laying on my head and the elbow just starts to feel like it's gonna, you know, like give out or get out of place. So immediately it just a very uncomfortable feeling and I have to readjust.
Gotcha, gotcha.
Also limited mobility and stretching, or if I'm gonna do like, you know, like I can't bring it, like sometimes they try to stretch me and right here it won't, you know, go past. It's like, that's what I've been told, that I have limited mobility in my shoulders.
Gotcha. Okay, so do you have any problems doing shoulder press or bench press? No,
shoulder press, bench press I can do.
Okay. No problems with pullovers or skull crushers?
No.
None of that stuff. Any particular activity you notice while you're working out that makes it challenging?
No, not with that being concerned.
Most likely it's just typical external rotations.
Yeah, just external rotations. If I'm going to reach for something, it could pop, just popping noises, constant like cracking.
Gotcha. Let's do some quick tests over here. So your thumb's gonna be like this. Okay, go ahead. Slowly go, raise all the straight up. Give it go all the way up, all the way up. Put it down. Okay, that's not too bad. Go sideways. Okay, go ahead. Slowly raise it all the way up. No, don't compensate that way. Okay. Slowly go all the way up. That's not too bad.
No, but I could start to feel the tension when I go up.
Gotcha. And then now you're going to go backwards. Right there. Okay, now we're starting to get something on here. Okay, here's what I want you to do next. Okay, with your hand, you're going to reach the top here. You're going to go in the back of your body. So face behind this way. Let's start with the left one. Go ahead and reach on top over here. As far as you can go. Okay, try this one, please. Okay, that's not too bad. And now reach behind, please. Okay, now we got something. Try this one, please. Yeah, also both restricted. Both of your hands, they really should be around here, not way down here, right? So that tells you, okay, so there's something going on with your lats. Yep, they're both tight, both sides. And it's swollen, puffy here, the fourth lumbar. So we're gonna investigate what's going on with that fellow over there, because this is one of those areas that deals with the lats on both sides, and don't be surprised that's going to be compromised when we do a thorough test on you. Okay, go ahead, turn around, face the viewers over here. So now backtrack a little bit here. How did you get that deviated septum in the first place?
Boxing.
And when was that?
Like 15, 20 years ago. 15, 25 maybe. Yeah, I did it for about, let's say 6-7 months. Thought I was going to go professional, but you know, I very quickly learned that, you know, it was a tough sport.
It certainly is. Yeah. It certainly is.
I got my nose broken as an amateur with a professional fighter. I only had 6 months. He had about 10 wins, 0 losses. He was already fighting to, you know, be up there, and he was just too much. He hit me with some punches and dancing around. I couldn't catch him, so he broke my nose.
Gotcha. All right, so we covered that aspect of it. Other aspect, right? Left elbow. What's going on the left elbow there?
The left elbow, just right here. It started hurting maybe 6, 7, 8 months ago, and it started with a little bit of pain that I thought I could, you know, tolerate. More and more, kept ignoring it, and it kept growing until just recently it's like shooting like in my forearm, But I used some Tiger Balm to kind of like ease it down, and it did kind of help, but I still have that pain, and I feel like it's going to flare up in the future.
Because, I don't know if you viewers can see, it's swollen here. Right in that joint capsule right there. See, when we take a look at over here, see, it's not too prominent here. It's a little puffy here, but nothing like the left. Left is really protruding over here. It's really sticking out. Like that. Okay, well, we'll take a look, see what's going on with that fellow. And you also what else is in the neck, mid back, lower back as well, right?
Yeah.
Okay, so close on what's going on with those fellas.
Yeah, so with the lower back, on and off, like within the last 6 years, it's been just, I would wake up sometimes and feel like, you know, it's like hard to stand straight. Like, I don't know if it was a bad position or whatever the case, or if I did something that irritated the day before, but it would just, you know, I would feel like sharp pains, and sometimes it would just be like just trying to ease my way into a good posture would hurt. So I would think that stretching would actually help, but when I would stretch, it would actually make it irritate a little bit more. So, you know, at that time, but then it would go away, but then it like randomly pops up, you know.
Gotcha. Neck, similar story?
Neck, so with the neck, I've always had this sharp nerve pain right here shooting across whenever I'd get a massage. I'd feel it. It's like a needle being pushed through. Yeah, it's pretty crazy, the feeling.
All right.
Yeah.
So let's start piecing everything together. So the deviated septum, this one we could easily see over here. That's just something right there.
Yeah.
But you see, it's like that. So I'm seeing it's like that. So it's shifting over to the right side.
Okay.
So obviously we got to make it like this way.
Okay.
But also, I'm seeing all your sizes. See that? It should be all clear. It's all filled up. Okay, so you got a lot of material inside your maxillary sinuses.
Yeah.
And frontal sinuses, everything's all clogged up in there. So that's the easy part there. Okay, so we'll see what we can do to help you with that part. But the more interesting challenge biomechanical is, so you're saying, problems with the shoulders, right? And only to external rotation. No problems with doing the push-ups, pullovers, shoulder press, none of that stuff.
Yeah.
So the reason why I'm saying all that stuff is because there's a particular muscle that's called the lats. So we have the scapula over here, the shoulder blade, okay? Now we have a muscle, it's called the lats, okay? Now it attaches a part of it over here, the inferior tip of the shoulder blades, but also attaches at the shoulder and right down here at the fourth lumbar area, typically. So the fact that you're saying that, I have a little trouble going to external rotation there, okay? So I want to see what's going on with this muscle over here, okay? Now, in addition to, it's also usually when there's some kind of shoulder problem, usually the second dorsal vertebrae I want to take a closer look at as well. The other reason I'm saying I want to investigate this second dorsal over here because it has a side slip over here. So to clarify what I mean by this, usually when a bone over here, when it rotates, okay, there's some movement over here. What I don't want to see is this thing is so twisted up, okay, and it rotates so much. See how much is like sticking on the side like this?
Yeah.
Okay, so that's what we call a side slip, because since you have these bones over here, no matter how much I return, that's where it's going to stop. Okay, but since it's twisted up so much, okay, there's no choice but to go to the edge. See, it keeps on going like that because it's so twisted. It's pivoting at that point. So that's what's happening over here, where everything should be, where you can see here is easy to see, nothing sticking out. But over here, see that? You got that bone sticking out over there. So this bone over here is side slipping and it's rotating, going quite a bit that way. So when that happens, biomechanically, it is going to affect your sternoclavicle joint over here, and I'm going to confirm that on you, but I wouldn't be surprised when I test these fellows over here, it's not moving, all right? Because that is one heck of rotation. So how do we get that kind of rotation? Because we see over here, see this, the spinous process, this is supposed to line up, but this one went way off to the left, and this fellow went to the right, left again, all straight down. You want like this mess. So
all these little ones in the middle.
Yeah, the spinous processes, and the same thing with these pedicle shadows here as well.
Okay.
Everything should be like this, but why over here it's like twisting so much, like that, quite a bit over there. But we also have an interesting challenge because when I'm start looking all straight down, what caused this mess down here, tracing all down, I see a lot of degeneration on this side. So when there's so much degeneration over here, that tells me there should be an external rotation coming from the left hip. Okay, but you know, we just touched base on the history itself. And that's why the history itself is very important, guys, is because you boxed, and now it comes down to what's causing this hip to go all the way this way. So, which hook do you favor? Do you favor pulling the hook with the left or to the right?
To the left, especially when I'm training on the bag. You know, I'll throw the left, the right, left, right, and then I'll always do the left hook.
So you finish with the left hook?
Left, right, and then the hook, always like those are like combinations.
Bingo, so there it goes. So to the viewers who are not familiar, boxing, boxers actually draw a lot of their punching power, not from the arms or the shoulders, it's actually in the hip.
Right.
So the fact that you're constantly throwing your hook with the left, that means you're twisting your hip, constantly going this way. So that actually clarifies it. Now it makes sense why this is degenerated, even though hypothetically this should be the real problem, but this is also showing up as well.
Okay.
So we're going to perform on you. Which one do we need to triage? Do we need to address this more recent injury you did yourself during your boxing days? Or do we need to address this older problem, this original right hip problem? Or possibly this sacrum over here? I don't know. We got to investigate, because I do see a small little posterior open gap over here, just very tiny. I need to check what's going on there. But because of this, the way I see is this: if we backtrack like 20, 30 years ago, what I'm seeing, three-dimensionally in my mind, is that because this thing locked up, then you were doing the boxing, constantly throwing with your left hooks, and this is locked up, is causing a significant irritation and biomechanical stress and strain and a lot of twist. Constantly going like originally supposed to go like this way, but now all the hooks going this way, and that's what's throwing that fourth lumbar out. That's also irritating the shoulders. So I want to investigate what's going on with that one, because as we see over here, okay, you don't have much of a disc left in there. Okay, it shrunk quite a bit. I want to see something that looks like this fellow here. There should be a nice, good, decent disc space over here. But you see this over here? It's shrunk on the front and very little left on the back. In addition to, we see all these tunnels over here, and it's very small over here, very small over here. This nerve, that's the actual size of the nerve, it needs to come out of this tunnel. But because your fourth lumbar vertebra went backwards like this and this, guess what's happened? The tunnel collapsed, it's irritating and putting pressure on that nerve over there. It's not going to function too well to whatever it's connected to. So we're talking about, it could affect the testicles, the prostates, the legs, the knees, and your lats. So over here, and also this pelvis problem over here, as we touched base before, that nerve, the fourth lumbar, it's going to affect the lats. It's also going to affect the prostate, and also the testicles as well, and also the colon, and also goes all straight down to the knees. Okay, so viewers can see over here, look at this, it's all swollen over here. But more importantly, look at the second dorsal over here, very swollen. Yeah, see the sixth dorsal here, it's also swollen here too, there's a lot of swelling. Yeah, see this fourth lumbar and third lumbar, both of these two fellows, and they're not happy. Tender here?
No.
No. But I feel quite a bit of swelling all around this sacroiliac joint. How's this fellow right there?
A little bit.
A little bit, right? Yeah, you got some puffiness right on this medial side of the joint over here. Yeah. What about down here?
Little.
Yeah, see, there's some swelling, some puffiness here too.
Yeah.
So we're gonna check out with instrumentation This device here is gonna look for those abnormal temperatures which that's given off from damaged tissue due to the inflammatory process. So this is gonna help identify some potential areas. Yeah. See, this is locking up on the external rotation, the EX component. This is also locking up too. Feel that right there?
Yeah.
Which one's worse, your right side or the left side?
Oh, they're both lightly tender.
Lightly tender. Yeah. But this is actually a little more.
Yeah, that one's a little. That right there is just
yeah, see, that's not too happy there either. How's this fella right there?
No, that doesn't feel at all.
See, 5's moving. So yeah, 4's stuck. How's that fella right there?
A little light tender.
Yeah. How's this fella right there?
No, it doesn't feel it.
Yeah, it's not moving too well. Feel that right there? See, your second dorsal is not moving at all. It's a brick wall.
That feel a little tender.
Right there, right?
Yeah.
Yeah, see, you got that small joint capsule. It's trying to stabilize this fifth cervical right there. See, it's not moving too well. Right there.
Oh, yeah, tender right there.
Yeah, that's how I check your atlas. It's moderate fixation, but it's not a true.
When you turn it this way, it's getting really tender there.
Exactly, because this is compensating. This is not true subluxation, so we'll leave that alone. That also explains your jaw. Open, close. See, there you go. You do have TMJs. Relax right there. There it is. Walk around, brother. Tell me, what's different?
It feels a little bit like looser, like it's not as tight.
All right, give the shoulders a try.
I'm still doing that noise, that crackling noise, but I feel like it has a little bit more range. Yeah, it has more range.
See? Magic, brother. Didn't even touch your shoulders.
Yeah.
So we have to address the root cause.
Wow, okay.
That's what I'm saying. It's like both of those hips were, you know, they're funky. Your old right hip problem, and then you were throwing that off with the left due to the left hooks.
Yeah.
That's what caused that fourth lumbar to go a little screw you in there. Okay.
Wow.
Now we're gonna get that fourth lumbar a little more better, so we get more nerve function to this fellow over here. Yeah. Oh, there's a part. There we go. Come on up.
Oh shit. Okay. Wow, I felt that. It like sent a shock through the back. Okay.
Go ahead. Try the shoulder.
A little more better, yeah. Wow, it's got now. Okay.
A little more. A little more. There you go. The shoulder. There it is. This is very right there. Sweet spot. There's that fella. Come on up. Okay, go ahead. Give those shoulders a whirl. still got this.
Yes,
okay.
Lock.
Have a seat.
But I feel more mobile.
All right.
Just clicking.
No, you neck your bicep tendon out for that one. Feel that right there?
Yeah.
Yeah, see that's that tendon. Bicep tendon. So we're gonna hook it. Nope, also it's a little slippery. There it is. Yep, we got it. Come on up. Okay, try that left shoulder out.
Yeah. It feels more mobile.
Yeah, that's what we're talking about, bro.
It's still giving that crack though with that.
Yep. Now I'm gonna restore the nerve function from here.
Okay.
Over here.
Wow. it's like it's crazy.
It's not crazy, man.
No,
it's
just like almost like you just did like a full stretch, but without even stretching. I thought it was all stretching problem.
No, that's what it's all about. It's biomechanics and restoring nerve function.
Yeah,
you know?
yeah.
Yeah, it's swollen right there, so. And the viewers had already pointed out before, it was swollen here. Yeah, see, this joint capsule is still swollen. Oh yeah. See, it's loose over here. See, over this way, that's unstable. Doesn't move. There's too much give.
Uh-huh.
Nah, that's a problem.
Oh yeah.
See, so you have a lot of ulnar. Right there, this is swollen.
Oh, now when you're pressing in, I can feel it again.
Oh yeah.
Yeah, yeah.
So we're gonna pump the fluid out of the way before we set this thing.
Okay.
Okay. A little more. Nope, we're still gonna pump a little more. Right there. There we go. Relax. Okay. There's a little lateral component as well. And an EX component. Slight EX. Relax.
I never knew you could crack the elbow like that.
How's it now?
Wow, it feels better. Guys, I was feeling a little bit of pain when I came in here, but now it's like, it's almost numb. Like I can't feel the pain anymore.
Good. Open. Close. Oh yeah. Oh yeah. We definitely got TMJ. Open. Close. Open. Close. No, too fast. Open. Close. Open. Close. Okay, that's good. Open. Close. No, too fast. Open. Slowly close. Open. Close. Open. Close. Open. Close. Open. Close. Okay. Give that a try. See how I like it.
It still does that.
Set that for me, please. Okay. Go ahead. Open. Close. No, too fast. Open. Close. Open. Close. No, there it is. Open. Close. Open. Close. Open. Close. Open. Close. Okay. Now I'll try to draw.
A little better.
Yeah.
Yeah.
Because don't forget, you got rung down a little bit too in boxing. So
yeah.
Right now the grooves in your TMJ joint itself is a little worn down. It's going to take about 3 to 6 months for the collagen to rebuild that grooves in there. Right?
Okay.
Okay, last part. We saved the best for the last, guys. Deviated septum.
Excited for this part.
Yeah, it's really out. Let it go. Good. See, even nasal bone. See, let's set this nasal bone up. A little more. Oh, that's really jangled. Hold on a second. I'm gonna move this bone. There's a piece. Good. Okay. See, right now, see both of your maxillary sinuses? They're not moving. It's all filled with, it's all inflamed and swollen. In there, a little more deeper. Gotta realign it. See, even your frontal, all of it's all, wow, all filled with stuff in there. Oh, this is not too bad. Okay, come on up. Okay, go ahead. Blow your nose out. Well, traffic over there.
Yeah. Opened up now.
Go ahead. Let's close up one nose. Let's try the other one.
It's still this one.
Yeah. Okay. But how's it overall right now? How's it breathing?
Yeah, better than before. Before I couldn't breathe.
How much better would you say right now?
About 60% better.
Okay.
70% better.
All right. So here's the story. Because right now you're very congested. There's a lot of congestion in all your sinus cavities over here. The nasal sinus, the maxillary sinus, the frontal sinus, even the sphenoid. All of it's all clogged up. Okay. So the next 36 to 48 hours, it's going to take some time for everything to start draining out. So there's three possible scenarios. Either A, it's going to feel like, so holy cow, feel like a waterfall gushing down the back of my throat. B, feels like a little post-nasal drip, some dripping. Okay. And then C is more like, I feel like I need to cough something out, but there's nothing to cough out. There's nothing. Okay. So there's like a tiny little trickle back of your throat. Okay. It could be either of those. To speed it up, what you do is get a nice steam bath, breathe the vapors in to flush even more sinus cavities out.
Okay.
Okay. All right, brother.
All right.
Anything else?
That's it.
All right, man. We're all set.
All right.